Facial injections. You see them everywhere. They're one of the most popular cosmetic procedures on the planet, promising a quick, almost simple way to smooth out a few lines. But behind that seemingly simple fix for a smooth forehead lies a hidden world of incredible complexity and serious risk. So, let's dive in and really look at what's going on underneath the skin.
Okay, so we've all seen results just like this, right? A couple of quick injections and poof, the wrinkles just seem to fade away. It looks so easy, almost like a magic trick. But what does it actually take to get this result, not just well, but safely? Well, the answer is a lot deeper than you might think.
All right, so before we can even get into the risks, we have to understand what the goal is here, because it's not just about randomly squirting some filler in. It's about surgically targeting the very specific muscles that are causing those wrinkles in the first place.
And this diagram shows that perfectly. You want to fix forehead lines? You've got to target the frontalis muscle. But look closer. See that little instruction there? Do not inject within 1 centimeter of supraorbital rim. So right from the get-go, we can see this isn't just some simple game of pin the tail on the muscle. It's about intense precision and actively avoiding some really important stuff.
Most of the common treatments are really just focused on a handful of muscle groups. You've got the frontalis for the forehead. Those cranky 11 lines you see between your eyebrows, that's the procerus and corrugator muscles doing their thing. And crow's feet? Well, you can thank the orbicularis oculi for those. On the surface, it looks like a pretty simple map, but the real story, the important one, is what's hiding just underneath.
Because once you get past those muscles, you're entering a totally different world, a hidden, incredibly high-stakes maze filled with vital structures you absolutely do not want to hit.
So if the muscles are the target, what's the biggest obstacle in the way? What is the one hidden danger that every single person giving an injection has to navigate with absolute pinpoint precision?
This is the hidden map. I mean, just look at that. It's an unbelievably complex network of arteries and veins, the facial vasculature, that's feeding blood to every single part of your face. It's not a roadmap. It's a dense, three-dimensional maze that is sitting directly in the needle's path.
And you can see just how dense and tangled this whole network is. These aren't just a few little lines here and there. It's a full-on, intricate web. This is the danger zone. And accidentally hitting one of these vessels, the consequences can be absolutely devastating.
And here's the real kicker. This vascular maze, it's not the same for everybody. It's unique to you. So you can't just memorize a diagram from a textbook and call it a day. To do this safely, you need a deep, fundamental understanding of anatomy to navigate each person's unique landscape.
Okay, so we get it. It's dangerous. Now, how do the experts actually learn to travel through this vascular maze as safely as humanly possible?
Well, pros follow a set of best practices, what they call the pearls of safe injection. Things like, it's better to inject too little than too much. You always keep the needle moving. You inject slowly with the least amount of pressure. And there's another really key technique called aspiration. That's when you pull back on the plunger before you inject, just to see if any blood comes into the syringe. If it does, that's a huge red flag, you're in a vessel.
But, and this is a really, really big but, none of these techniques are perfect. Even aspiration can fail. It can give you what's called a false negative, which means you are inside a blood vessel, but for whatever reason, no blood comes back. The scary bottom line is there is no 100% foolproof method to avoid risk.
And, this need for deep anatomical knowledge, it goes beyond just the filler itself. Even just numbing the face with what's called an anesthetic block requires knowing the exact spot where major nerves pop out of the skull. It's just one more piece of proof that a successful procedure on the surface depends entirely on mastering the deep, hidden structures underneath.
So, with all this complexity, what actually happens when things go wrong? When a needle does find its way into that vascular maze, what does it look like and what on earth can be done about it?
The complication that everyone fears most is called vascular compromise. This is when filler either gets directly into a blood vessel or just presses down on it from the outside, basically choking off the blood flow. The first sign is often the skin suddenly turning white, blanching, and if it's not treated immediately, it can lead to the skin tissue actually dying. That's necrosis.
When this happens, it is a flat-out race against time. A quick, knowledgeable response is everything. You have to stop the injection immediately. Then the goal is to get that blood flowing again. You massage the area, apply warm compresses, use special medications to dissolve the filler or open up the vessel. Every single second counts, and you have to have an absolute expert in charge.
You know, this brings us to the single biggest takeaway from this whole explainer. It's the one principle that is behind every single safe and successful procedure.
Just let this quote sink in for a second. Because what it's saying is that safety isn't really about the brand of filler you use or how fancy your needle is or even having a steady hand. The number one rule, the core principle, is having a deep appreciation for and knowledge of the invisible anatomy.
And this image, well, it puts everything into perspective, doesn't it? On the left, you've got that simple, clean result that people want. And on the right, you have the staggering complexity you have to navigate to get there. The real journey from before to after is that trip through the hidden maze.
So, when it all comes down to it, getting those smooth, youthful results isn't a surface-level skill at all. True mastery isn't just about what you can see on the outside. It's about a profound understanding of that hidden map that exists inside every single one of us.
Which really leaves us with one final crucial thought. The goal might be surface-level beauty, but achieving that goal safely depends entirely on a profound depth of knowledge. What seems so simple on the outside is in fact one of the most intricate and high-stakes journeys in all of cosmetic medicine.